Alexander Pate. I work at the HeRC, the Health eResearch Centre, which is part of the Farr Institute, and it's based in the Centre for Health Informatics at the University of Manchester. My work's in the statistical methodologies of pragmatic trials, and the difference between pragmatic trials and normal randomised controlled trials is that a pragmatic trial tries to assess the effectiveness of a drug in real world, so in routine practice, prescribed over the counter, as opposed to a normal randomised controlled trial, which is in quite strict conditions. This is important because a lot of the time, when a drug's past its initial phase 1, 2 and 3 trials, we completely stop assessing its performance in the general public, and it could actually be the case that the drug or the new intervention isn't working as well as the current standard of care, in which case you shouldn't be having this new intervention. So it's to try and build these new trials which will actually follow drugs in routine practice and see how well they're doing. I'm hoping the impact of my work can try to inform the operational challenges that are found to be in this area of work as well. So running pragmatic trials is hard statistically, but it's also hard operationally, because all the guidelines which are there are for these normal randomised controlled trials on these drugs that haven't been tested and they could be potentially unsafe. So all the stringent conditions need to be there. Whereas in a pragmatic trial, this drug's already passed its 1, 2, 3 and phase trials, and these operational challenges shouldn't be there, these things holding them back. And so hopefully if we can show these trials as statistically beneficial, then it could push people to be able to get through it on the operational side as well. When I finish my PhD, well, at the moment I'm enjoying it a lot, so I'd like to continue to stay in this area, but maybe broaden my horizons a bit. So at the moment I'm working purely in the statistical side of things, maybe move out and get an idea of how it is more on the medical side and things like this.